My name is Dr. Al Benson, and I'm a professor of medicine and a GI medical oncologist at the Feinberg School of Medicine of Northwestern University and the Robert H. Lurie Comprehensive Cancer Center. This, of course, is a very frequent occurrence. And for many individuals, the dominant disease is in the liver. And therefore, considering a liver-directed approach would be very appropriate. There may be some individuals with very limited liver disease, very low volume disease. And in fact, for some of these individuals who are asymptomatic and have well-differentiated tumors with a low proliferation index, for example, a Ki-67 of 1%, observation may be even appropriate. Otherwise, there may be select individuals with very isolated disease where perhaps a surgical resection or ablation or stereotactic radiation may be an appropriate consideration. For individuals with neuroendocrine tumor in general, we strongly recommend as initial evaluation obtaining the highly specific nuclear medicine imaging for somatostatin receptor positivity. So for example, a gallium-68 dotatate PET-CT scan is highly specific for neuroendocrine tumors and is quite sensitive and can help us determine the extent of disease in the liver, but also if there's presence of extrahepatic disease. If such determination is positive, then people with liver metastases may have as their first option somatostatin analog therapy with octreotide or lanreotide. And then if they are experiencing further disease progression and they have liver dominant disease, which is typically more extensive than can be handled with local measures, then the consideration of yttrium-90 radioembolization, for example, or bland or chemoembolization would be an appropriate option. Other options do include the systemic approaches such as PRRT with lutetium-177, or systemic therapies such as everolimus. But I think overall, what's critical is to determine how extensive the disease is, to carefully evaluate looking for other sites of metastatic disease, and working with our colleagues, for example, in interventional radiology to determine what might be the most appropriate assessment and intervention for these people. At my institution, we typically discuss these individuals at our multidisciplinary GI oncology conference to determine if a liver-directed approach is feasible and appropriate to help enhance the control of the individual's metastatic disease.